Hello everyone, I am urologist Omar Makaya. Today I will talk a little bit about performance anxiety. Performance anxiety is the stress you face when you have to present a skill. In other words, a skill, a presentation, an exam will be held. And you will test yourself and others will test you in this exam. And in this exam, you get excited. So this can be a driver's license exam, a university exam, or your sexual performance to the other partner during sexual intercourse. In short, we can call this performance anxiety. What is the problem here? Now what normally happens to people in the exam? They do very well in the practice exams, but in the real exam they can suddenly fail. I wonder if I will be successful in the real exam. In fact, when there is nothing, people can fail in the real exam while they do very well in the practice exams. A whole year's work can be wasted. A situation like this is actually what we call performance anxiety. It is a troublesome situation that we encounter in all areas of life. It varies from person to person. Some people have very high performance anxiety. And they can actually fail the exam they are going to take. The subject I am talking about today is actually performance anxiety in sexual intercourse. Our practice exams can be likened to masturbation. The patient may feel very successful in masturbation, but when it comes to sexual intercourse, he may encounter failure. Or he sees himself weak during masturbation. He thinks that he will also fail during intercourse. Performance anxiety can also occur in a man who has never had intercourse. The person is masturbating. Let me give an example right away. One of my patients called me last week. He ejaculates early in masturbation. Or he ejaculates early in oral intercourse with his partner. He will get married a month later, and he is very afraid of failing in his first sexual intercourse in marriage and being embarrassed to his wife. He goes from doctor to doctor. Then a doctor suggests to make penile head filling. If you travel this much, of course, you will encounter a doctor who will do something. But filling the penis head for a person who has never had intercourse before, whose performance in sexual intercourse you do not know, is like doing the last treatment first. Why? Because this patient has no sexual experience. He has no sexual knowledge at all. He has no knowledge of behavioral treatments for premature ejaculation. He has not used any medication or medical treatment. Filling the penis head directly also disrupts normal physiology. Because maybe after the sexual life of this person starts, this person will ejaculate normally, but when you fill the penis head, maybe this time he will start ejaculating late. This is a patient with a complete performance anxiety problem. My suggestion to this patient was this. 30 days after marriage, the problem of premature ejaculation disappears 90 to 95%. Because the best treatment that treats the problem of premature ejaculation is the patient's repeated intercourse. As his sexual experience increases with intercourse every other day or every day, the problem of premature ejaculation will disappear 90 to 95%. But isn't there performance anxiety in old age or middle age? It happens in middle age too, friends. We also encounter sexual performance anxiety in middle age. I mean, let me give an example. I had a 50-year-old patient. He ended his 20-year marriage 4 years ago. Then he found a new female partner. He is going to build a new life, a new home. But his female partner said one thing. She says that she divorced her first husband because he ejaculated prematurely, had erectile dysfunction and constantly had unsuccessful sexual relations. As soon as she says this, the man is shocked. Because he feels that he has not had the same pressure in masturbation lately. And because he hasn't had intercourse for years, he is very afraid of failing. Years later he met a woman. He thinks he's going to live the rest of his life happily, but she makes a condition. Maybe she didn't make it a condition, but he understands that. If he is underperforming, he shouldn't be around at all. That's how a lot of men understand it even though women don't mean it that way. Then he comes to me. He says, "Sir, what are we going to do? What did we do to the patient? We checked his hormones. We checked his vitamins. We optimized them. Then we did shock wave therapy. After that, we started some medications. Then, after he was very successful in his sexual relations, this performance anxiety disappeared. He became more confident. After that, we gradually cut down on the medication. He is doing very well now. Of course, such a condition imposed by the female partner actually puts a lot of trouble not in the sexual relationship but in the couple relationship. Why does it cause trouble? It's a condition. When she says, "Look, if this happens, we'll break up," it puts the man into performance anxiety. But it can also cause other problems in the couple's relationship. Because a woman who says this in sexual intercourse may have other conditions in other matters. If a man's female partner comes to us and tells us how we are going to overcome this problem, if she sees the erectile dysfunction as a couple problem, that man's back is not easily broken. Why? Because the man does not have a performance anxiety problem. If I fail, my wife laughs it off and there is no problem. He doesn't care about it at all, he doesn't think it's a problem. And his wife is constantly motivating him to stimulate his masculine energy. She is constantly trying to get his masculine energy out. The female factor, which we have talked about in previous videos, is very important in a couple relationship. If the woman cannot attract the man sexually, of course there can be very serious problems. Even if the man has no organic problems, he can have erectile dysfunction. He can experience it very easily. He can have a much more comfortable intercourse with another woman, a woman he does not know at all. In couple relationships, you can feel both negative feelings of hate, anger, and love towards a woman at the same time. If emotions such as hate, anger, and hatred are high, feelings such as lust and love inevitably begin to decrease. Emotions such as desire begin to decrease in the couple. As a result, sexuality in a couple relationship is one of the important ties that bind the couple together, but it is also one of the ties that separate them. If there is sexuality, the man is actually bound. After all, he turns around and around, like an atom, it binds somewhere. Thank you for listening, best regards.